All right, welcome to the respiratory system. We're going to first start with anatomy before we get into the physiology. So the respiratory system can be structurally broken into a upper respiratory system, which is basically what you would consider like in your head. So like your nasal passageway, your oral cavity, and possibly even your throat, versus the lower respiratory system, which is really your bronchi and your lungs. Now, functionally, we have a conducting zone. These are simply the interconnected tubes that are going to transport the gases to and from the lungs, or to and from, I should say, the respiratory zone, where gas exchange is actually occurring. So these are respiratory bronchioles. These are tiny, tiny little tubes, alveolar ducts, sacs, and then the actual alveoli. Let's take a look at parts of the anatomy, starting with the nose and the internal and external nasal structures. So I think you're all aware that your nose has a bony component made up of the frontal bone, as well as the maxillary bone, as well as a cartilaginous portion that makes up sort of the tip of your nose and part of, I guess, that middle part of your nose. And then also making up parts of the, the lateral portions of the nostrils, along with some fibrous connective tissue and some adipose tissue. The openings are called external nares or nostrils that we're more familiar with. On the inside, in this nasal cavity area, we have our nasal concha or the turbinates. So you have a superior, a middle, and an inferior nasal concha. And then there's grooves that are formed by these concha, and those are called meatuses. So that there's simply a superior meatus, an middle meatus, and then an inferior meatus. These are going to allow for very smooth airflow to the back of the throat. Right before that, there's sort of this area, it's called the vestibule. That's, if I can say it this way, that's generally about where you would go to pick your nose. If you're about a knuckle deep, you've gone too far, and you would be into this nasal concha area. Other structures in the nose are olfactory epithelium, that's for our sense of smell. There's pseudostratified ciliated columnar epithelium, along with goblet cells that line the nasal cavity. This is not surprising, right? It helps trap dust particles, microbes, whatever might be out there. It will also help warm the air due to the high vascularity of the nasal cavity. The mucus, again, traps dust, as well as helps moisten the air. And then the cilia are going to move all that mucus back toward the back of the throat, where you then, swallow. And then again, the stomach acids would digest any of the mucus or any of the foreign microbes that are trapped in it. We have paranasal sinuses. You probably remember this from 201. Those are the ethmoid sinus, the sphenoid sinus, frontal, and maxillary sinuses. These sinuses help lighten your skull, as well as basically help form what is your voice. I think you know that intuitively. So the first part, that it lightens the skull. Think about this. When you fall, like if you're like sitting up and you're falling asleep, which way does your head usually tip? It kind of tips forward, right? And that's because your skull is kind of front heavy, the way it sits on a vertebra. So the sinuses being hollow helps lighten your face. And it also acts as a resonating chamber. So you know this, when you're stuffed up, your voice changes, you sound different. That's not just your imagination. It's literally those sinuses being plugged up with mucus changes the way the vibrations come from your larynx and the way that not only you hear yourself, but the rest of us hear you as well. The pharynx consists of three subsections. There's a nasopharynx, an oropharynx, and a laryngopharynx. I like this little image down here on the left. It breaks them up into these color-coded regions. So simply the nasopharynx is this part behind the nasal cavity. There is an opening to your eustachian or auditory tube. So every time you swallow, that opening opens. And it helps equalize the pressure in your middle ear. That's why, like, if you're going up in an airplane, you swallow, it helps pop your ears. Then the oro, right here behind the mouth, and then the laryngo pharynx. These are the common passageways for air and for food. Now, the larynx itself is composed of several pieces of cartilage. You'll see a model that looks a lot like this in the lab portion images. So let me just give you some orientation here. So here is the hyoid bone. Then we have the thyroid cartilage, and you see here even in parentheses, that's what we consider the Adam's apple. It's more prominent in men. However, women have it as well. It's just it doesn't stick out as far usually. Then we have what's known as the cricoid cartilage down here. And then the rest of these cartilages are just called tracheal cartilage or tracheal rings. There are membranes in between these structures. So the one that goes from the thyroid cartilage to the hyoid bone is simply called the thyrohyoid membrane. The one that goes from the cricoid cartilage to the thyroid cartilage is simply called the cricothyroid ligament. And those are the two main ones. This structure here that you see peeking up over here above the hyoid bone, but back in here, that is your epiglottis. So whenever you swallow, that's going to cover the trachea so food doesn't go down the wrong way. When you are speaking, it is open. So that's why they always tell you do not speak with your mouth full, because food may slip down into the trachea and you may choke. Let's see. Some other important structures are this arytenoid cartilage right here, and on top of that there's this little corniculate cartilage. That arytenoid cartilage is going to move, and that's going to change the position and tension of your vocal folds or your vocal cords, right? So that's what you're seeing here. Vocal fold is your true vocal cord. So I don't know how intuitive this is to you. Maybe if I explain it this way, if you take a rubber band and the tighter you stretch it and then you kind of pluck at it, the higher the twang sound you get, the higher the frequency twang sound. So similarly, that's how your vocal folds work as well, your vocal cords work as well. So if I wanted to change the pitch of my voice and make it go lower, I'm relaxing my vocal cords. And if I want to make my voice go higher, I'm actually stretching them. And that's going to be due to the actions of this arytenoid cartilage pulling on these vocal cords, stretching them or allowing them to relax. You can always click on this YouTube link. It'll show you a video of it doing that in real time. Okay, so going past the larynx, we go into our trachea, and then obviously we have a right and left lung. So the trachea has to split into right and left branches. So that will split into primary bronchi. So primary is that first split. Those primary bronchi are then also going to split once again. At that second time it's splitting, it's called a secondary bronchi. And then these will also split again. The third time it splits, it is called a tertiary bronchi. Okay, you can see that splitting branching pattern here. After that, they're simply called bronchioles, and then those bronchioles will split into something even smaller called terminal bronchioles. Before those terminal bronchioles end in alveoli. One other term for you, there's right here where that split between the trachea going into those bronchi goes, there's something called the carina. It's sort of a specially shaped tracheal ring. It kind of reminds me of like underwear, I guess. It kind of has that, I don't know how to describe it. It kind of looks like the typical underwear shape. Anyway, it has a special shape, so it has its own special name. Let's see, some other things to note on the lungs. The right lung is going to have 3 lobes. So you see here it has a superior, middle, inferior lobe. And then you'll notice that on the left-hand side, there's only a superior and inferior lobe. There's only 2 of them. And then you'll also notice this odd shape right here. That's due to the positioning of the heart. This is called the cardiac notch. Okay, so how easy is it for air to get to and from the alveoli, the little air sacs? Well, that resistance is going to depend on the size of the airways. So if you have a larger chest size, in general, airways are going to increase in diameter, which then would, as they increase in diameter, they're going to decrease in resistance. So think back to like the way blood vessels work, right? The bigger the diameter, the lower the resistance. There are some smooth muscles, especially in those smaller bronchioles. If those contract, they would cause a decrease in the diameter, which would then result in an increase in resistance. So again, same way that the principle of resistance worked in blood vessels, it'll work the same way in the trachea and in the bronchioles. And this is basically like what happens in asthma attacks where those airways constrict, right? Making breathing very difficult. If we take a look at the histology of the trachea, what we'll see is that inner lining is going to be ciliated pseudostratified columnar epithelium. The actual tracheal ring is hyaline cartilage. It is C-shaped, meaning it's not a complete circle. It's more of a C shape, just a semicircle. And the posterior part of the trachea is actually a muscle. And this makes sense. So if you look at this image, the esophagus is right posterior to the trachea. It makes sense that as you're swallowing things, this allows for a little bit better passageway of food instead of like if you had an actual tracheal, like a solid tracheal ring. So you also have pleural membranes and a pleural cavity. So there are, just as hopefully you learned in 201, there's visceral pleura that covers the lungs, and then parietal pleura that actually lines the rib cage. In between those two pleural surfaces, you're going to have a surfactant that, similar to what we saw in the heart, it's going to be slippery, and it basically prevents sticking of the lungs to your rib cage. As I mentioned to you, the right side is going to have 3 lobes. The left will only have 2. There is a cardiac notch for the heart on the left side. A couple of other terms for you. The base is simply this bottom part. The apex is simply where it comes to a point at the top. The costal surface is simply the surface that will be touching the ribs. And again, this cardiac notch here. There's an oblique and horizontal fissure. So you can see an oblique because it's at an angle, and then horizontal because it's pretty much going straight across. And then just an oblique fissure on the left. There's also this term hilus. So if you remember that, we saw that back when we talked about the lymphatic system. So it's simply this area where various structures, so either blood vessels or bronchi, enter or leave the lungs. That's just the hilus. If we take a look at the histology of the lung, you'll see there are these terminal bronchioles right here, which then feed into a respiratory bronchiole, which feeds into alveolar ducts. And these alveolar ducts then have all these alveoli around them. And that is any of these will be sites of gas exchange from the respiratory bronchiole down. However, most of that is going to occur in the actual alveoli themselves. The difference between an alveoli and an alveolar sac is just a sac is that cluster. An alveolus is just a single one of those circular structures. One of those alveoli will have 3 different types of cells. They're called type 1, type 2. They don't call them type 3 cells for whatever reason, but there you go. So type 1 cells are just the simple squamous cells that make up the walls of the alveolus. These are simple squamous epithelial cells. So that distance is very thin. So here you see a capillary. Here's just a blown up image of that surface between the capillary and the alveolus. Because it's so thin, it allows for easy gas exchange to occur. Type 2 cells, the old name for them were septal cells. So these are basically these cells that have macrovilli, and they secrete surfactant. Again, that surfactant prevents those alveoli from sticking to themselves, which would make expanding the lungs very difficult. And then you'll also find some macrophages. They're sometimes called dust cells because they're there to gobble up dust or anything else. Sorry about that. That was a very loud dog. Or these alveolar dust cells that are simply macrophages that will gobble up dust, making sure that those alveoli stay nice and clean and sites for gas exchange. All right, so that's a basic overview of the structures of the lung and the respiratory system. If you have any questions, please let me know.